will discuss on Tinea Corporis. Tinea Corporis is a superficial dermatophyte infection on the glabrous skin. That means skin regions other than the scalp, groin, palms, and the soles. A dermatophyte infection, also known as dermatophytosis or tinea, refers to a group of fungal infections that can affect the skin, hair, and the nails. 3 anomorphic or asexual or imperfect genera causes dermatophytosis. Those include trichophyton, microsporum, and epidermophyton. The mechanism of transmission is through contact. Tinea corporis spread by the shedding of fungal spores from infected skin. Transmission is facilitated by warm, moist environment and the sharing of vomits, including bedding, towels, and clothing. The incubation period is 1 to 3 weeks. Dermatophyte infection elsewhere on the skin, such as tinea pedis, can also be transferred. The dermatophyte invades and spreads in the striatum corneum. That is their unique feature, but is unable to penetrate deeper layers in healthy skin. We see risk factors for developing or having Tinea corporis. Tinea corporis is found in most parts of the world, but particularly in hot, humid climates. It is most commonly seen in children and young adults. However, all age groups can be infected, including newborns. There are medical risk factors and environmental risk factors. Medical risk factors include previous infection, diabetes mellitus, immunodeficiency, hyperhidrosis, xerosis, ichthyosis, and environmental factors include household crowding, infection of household members, keeping house pets, wearing occlusive clothing, recreational activities involving close contact with others, including shared and change rooms. When we see clinical manifestations, the most typical clinical lesion begins as a dry, mildly erythematous, elevated, scaly papule or plaque that spreads centrifugally and clears centrally to form the characteristic annular region. That is why they are called ringworms. At times, plaques with advancing borders may spread over large areas and they may coalesce. Most lesions clear spontaneously within several months, but some may become chronic. Difference in host response may result in wide variability in clinical appearance. From this, Kerone is one of them. This is an intense pustular inflammatory reaction due to zoophilic fungus. As you know, dermatophyte can transmit from human to human, from animal to human, and they can even live in soil. Tinea gladiatorum affects participants in contact sports such as wrestling or martial arts due to skin-to-skin contact. This is usually mainly due to trichophyton tonsurans. The other is tinea incognito. This lacks the typical features of tinea corporis due to the suppression of inflammatory reaction following the topical application of corticosteroids. Lesions tend to be widespread with poorly defined borders, unlike the typical one, lacking scale and erythema. The other is Majochi granuloma. This involves the hair follicles and the subcutaneous tissue mainly found on the limbs after shaving. It presents as perifollicular papules or pustules. When we came to the diagnosis, skin scraping taken from the scaly lesion edge and mounted on QH can be examined under light microscope for hyphae and spores. Tinea corporis is sometimes diagnosed on skin biopsy. Histology is typically required for the diagnosis of Majochi granuloma. When we came to treatment, general measures include skin should be kept clean and dried. Loose-fitting light clothing is recommended in hot, humid climates. Avoid close contacts with infected individuals and the sharing of vomits, and examination of household members and the pets for the source of infection and appropriate treatment reduces the risk of reinfection. With appropriate treatment and good patient compliance, Tinea corporis can be cured. Tinea corporis usually responds to treatment with one of the topical antifungal agents twice daily for 2 to 4 weeks. In unusual severe or extensive disease, a course of therapy with oral glycosphingolidine, terbinafine, or intaraconazole can be given. Thank you for watching.